The GPs that we've attended are, I'd say, fairly good. And one GP in particular, I think. The system that's bad, it's instead of an appointment time, you have to go and wait, and that takes about an hour. When you've got a young child, that's quite difficult. Mm-hmm. The hospital system has been fantastic, especially the children's. We've had a couple of appointments there, and they've been really superb. What I found is when I was in Shipley, I was a GP centre there, and they had a system where it was an appointment, and that worked really well. And I don't understand why it doesn't work as well in Sheffield. Mm-hmm. I know a lot of people say the appointment systems don't work in Sheffield because they can't get through.
A lot of the time, personally, I'm usually can't get to the doctors because I'm working. So the walk-in centre is a very good idea, I think.
Okay, if you had like a minor health problem, would you consider going to a pharmacist or ringing up NHS instead of going to...
We did the other night. My daughter was having trouble with her mouth, and rather than going to the doctors, we took her down to the pharmacist, the Boots one down the road, and the pharmacist saw her, told her what it was, and gave her some antibiotics to treat it. So we've used both, if you know what I mean. But I do think the pharmacist is a very good idea because it takes the pressure off the doctors and the waiting times at the doctors for people that do need to see a doctor.
I think there's a number of challenges in this area regarding people's health. It's a very multicultural area. There's a lot of new arrivals, asylum seekers and refugees, and there are good GPs practices, but a lot of people are not registered with a GP. They don't have access to even basic health care. In the sort of wealthier areas of Sheffield, you haven't got the ethnic mix. You, generally speaking, haven't got the number of new arrivals. You've also got people who are clearly richer and healthier. There's not the problems probably with diet, substance abuse, smoking, lack of exercise, all the rest of it. But also there's an understanding of how, in those areas, there'll be a greater understanding of how the systems and the institutions work and how they can be accessed at several levels. Generally speaking, you don't have that here.
This is my doctor is. I couldn't see it. They say he's busy. You have to come back for another week.
And is it like this every time you're trying to...
Every time I go there, it's like that.
It's really improving. I mean, things are happening, you know. I don't hear people complaining.
I mean, once you get into hospital, it's good service.
So it's not easy to get there?
But it's not easy to get there, and if you do go by private transport, it's a problem getting parking. Even if you want to pay, the car parks are not big enough.
I think the main thing is that I don't feel location at hospitals is that accessible. I had to take Imogen to doctors on a Thursday afternoon a few weeks ago, and none at surgeries in Sheffield run a Thursday afternoon surgery. It's when they do their out-of-hours visiting. So I had to take her to a GP, I think it's GP Collective at Hallamshire Town, and it's not that easy to get to. It's a nightmare to get parked. When you're already stressed out if your baby's not very well, you know, if you have to park and then walk 20 minutes to get to hospital.
It's difficult sometimes, particularly if you work full time, is accessing GPs outside hours, and maybe that's been the only source of dissatisfaction in the past has been at weekends with the kids in particular. If something occurs that you'd like to see somebody and speak to them about it.
The doctors has been brilliant. The only thing is you've got to ring up on the day to get an appointment, and you've got to start ringing from 8 o'clock in the morning, and obviously the lines are very busy, so you can't get through. I've tried it where I've actually turned up at the doctor's surgery and I've ended up with an appointment about 9:20, you know, even though I've got to the surgery at 8 o'clock in the morning. But that's the only problem. Really, so it's just actually trying to get an appointment on the day.
Hospitals, yeah. Actually, hospitals are quite good, yeah. The way they carry out stuff, the way they fill you up with information, yeah, that's fine. But not. I'm only against dentist, but everything else is fine, yeah. Northern General, Hallamshire Hospital, they're all good, yeah.
I found using my own personal GP that it was very effective and it was very helpful. Unfortunately, I had a problem with drugs for quite a number of years, which I recently kicked the habit about 18 months ago. And my doctor was one of the only few doctors that did an actual implant that stopped me from using. And he was very effective and very helpful in achieving me getting that, you know, whereas a lot of other doctors I found just seems to turn their back on me, you know what I mean, due to it being a drug problem.
We've had good experiences, the whole family, with the walk-in centre at the Hallamshire Hospital. That's really good, where we've had I had mastitis, which makes you ill very quickly, at a weekend, and they were fantastic. They saw me in 20 minutes, they gave me the antibiotics there and then sorted. Really good, yeah. One thing that's impressed me is I've always seen him, well, it's only been a few times he's been, but they've seen him very quickly, within a couple of hours when he's been. They've been very good, yeah, definitely. So yeah, been impressed.